Welcome to Toledo Clinic TV. Our guest for this segment is Dr. Naeem Lughmani, and he is a sleep disorder specialist. This is a huge topic for people because sleep is so incredibly important just in our daily lives. Yep. Let's talk about, for this segment, what are some of the best sleep practices? How can you develop healthy habits to get a good night's sleep?
Actually, first thing we have to realize is that sleep is so extremely important for us. We have to sleep every day, and there is a reason for that. In the daytime, we actually use our body, our immune system, our muscles, our glands. So at night, all of that has to be recovered for the next day. So if you have that concept in mind, then you realize how important it is to fall asleep at night. Typically, at least 7 hours of sleep is mandatory, I would say, but 8.5 is the best. So we talk about sleep practices. I think the best thing is, first of all, the timing. So you have to know what your circadian rhythm tells you. Most people, it is between 10 and 11 p.m. that you start getting a little fatigued. That means that a melatonin starts to come out, and that's the time you should go to bed. And then your bed environment needs to be comfortable, your room needs to be dark. You should not do anything stressful at that time. So watching TV, looking at the phone, that will disturb you. And then of course your alarm clock should be 8 hours from that time, so you should try to sleep all night. So these are some of so the time is very important. The other thing which is important is caffeine use. So people these days use a lot of caffeine, and a lot of that is related to sleep deprivation, so they don't sleep enough at night, and that results in excess caffeine use because of fatigue. Of course, some of them will have sleep disorder as well. So avoid that. If you have to do it in the morning time. Exercise is important, but not right at bedtime. It has to be at least 3-4 hours before bedtime, because that can sometimes makes our body warm and then makes us not being able to sleep at night. So these are some of the tricks you can use to have a healthy sleep.
Now, if you cannot get the 8.5 hours that are recommended, which I know is incredibly difficult to do, are there things you can do to make sure that the sleep that you are getting is good quality sleep?
Yep. So 7 hours is recommended these days. Anything less than 7 hours is not good. Actually, there is a data came maybe 3-4 years ago where there's people who slept 6 hours of less. They develop dementia. There's high risk of dementia in that, so you have to be cognizant of that. So these days I see patients all the time, they're sleeping 4, 5, 6 hours because they're using CPAP, and we have a data on that to see how much they're using it. So it's important to do that, to sleep at least that amount of time. You have to watch your medications too. Some medicines will make you have poor sleep as well. So as we get older, we get on medicines like diuretics, for example, and make sure that you don't take it late at night because that will make you wake up at night as well. So
yeah, and uninterrupted sleep is the key, the goal.
Is the key. Yeah, if you do have interrupted sleep and your sleep is poor and you're trying your best to sleep but it's not working, then you need to see a sleep doctor. You need evaluation for that. Find out what the cause is. Is it insomnia? Is it sleep apnea? Is it some other sleep disorder which is going on? Sleep disorders are extremely common. Sleep apnea, if I get 100 men from the mall and say, let's do sleep study on them, don't ask them questions, 24 will have some sleep apnea, 4 will have significant sleep apnea, and women, it is 10% have some, and 2% have pretty significant sleep apnea. So just looking at sleep apnea, there's so many people have. So you have to, if you yourself cannot fix your sleep by doing the sleep hygiene things that we talked about, then you have to get evaluated, find out what the sleep disorder is, and then treat it, and then you'll feel better.
How do you know when you've gotten to the point that you need help from a professional like yourself?
I would say just do the basic sleep hygiene, try to go on bed on time, try to wake up on time. Caffeine use, you do it early, or try to avoid it. And if despite that your sleep is poor, and then you're fatigued in the day, tired in the day, then it's time to see somebody. I mean, it's extremely common sleep disorder, so it's very likely that you have some type of sleep disorder that can be easily treated.
Yeah, all right. That's important information. Thank you so much for being with us.
Yeah, thank you.